Welcome back. This is CPC Exam Part 91, covering the Medicine Section Coding Rules. We are bringing massive energy and laser focus today because we're completely crushing the specialized medicine, diagnostics, and rehabilitation rules. But before we crack open that CPT book, make sure to like, share, and subscribe to Decode Healthcare with Harshal. It really helps us keep bringing you these high-yield coding breakdowns. Here is our agenda for today. We're systematically locking down the coding rules for pulmonary diagnostics, allergy in immunology, neurology and sleep, and finally, PM&R timed rules. Section 1. Pulmonary Diagnostic Testing, codes 94010 through 94799. Let's master these non-invasive tests. You've got to know how to compare basic spirometry, that's code 94010, against 94060. Think of 94010 as just a basic evaluation of lung volumes and airflow capacities, but 94060? That includes a really crucial pre- and post-bronchodilator evaluation, which completely bundles in the aerosol administration. Literally, never code the aerosol separately if you're already using 94060. Which brings us to a total classic exam trap that catches so many coders off guard. When you see non-invasive ear or pulse oximetry for oxygen saturation, codes 94760 or 94761, you have to ask yourself, is pulse oximetry separately billable? The answer is a resounding no. Pulse oximetry is almost always bundled into your evaluation and management visit or into the primary procedure. It's just not separately billable on the exam unless it's explicitly provided as a standalone diagnostic test. Definitely keep that rule tucked in your back pocket. Moving right along to Section 2, Allergy and Clinical Immunology, spanning codes 95004 through 95199. This area is built on incredibly strict component and unit-based rules. You absolutely must separate percutaneous testing, like your scratch, prick, or intradermal tests, which are billed based on the number of tests or allergens applied as units of service. You have to separate those from administration-only injections, like 95115 for a single injection or 95117 for multiple. And then, you have to separate both of those from the actual provision and preparation of the antigen itself, using codes 95144 through 95170. Whenever you're reading a chart, always ask yourself, are they testing, are they injecting, or are they prepping the antigen? Now, here's a massive tip to remember. Allergy testing doesn't always mean skin tests. If you see in vitro wording in an exam scenario, just stop. That points you directly to pathology and lab codes, not these medicine section skin testing codes. Okay, Section 3, Neurology and Neuromuscular Procedures, covering codes 95800 through 95999. These codes are completely driven by exact monitoring parameters and patient states. For polysomnography or sleep studies, your documentation has to hit exact parameters to assign the complete code. We're talking EEG for brainwaves, EOG for eye movement, EMG for muscle activity, ECG for heart rate, plus airflow and oxygen saturation. Miss even one of these, and you cannot build a complete polysomnography codes in that 9588 to 9581 range. The counting mechanisms here are also completely different. Routine EEGs are non-invasive brainwave monitoring based on time duration and whether the patient is awake or asleep. Contrast that with nerve conduction studies, or NCS. NCS coding is driven strictly by the total number of nerve studies performed, completely independent of time. And hey, remember to watch out for combined EMG and NCS coding guidelines when both are performed, because those frequently pop up together on the CPC exam. Keep an eye out for two major exam cues: CPAP titration and patient age. The presence of CPAP titration and the specific age of the patient will instantly drive your sleep study code selection. You want to highlight those details the second you see them in a test scenario. Now for Section 4, Physical Medicine and Rehabilitation, codes 97010 through 97799. Welcome to PM&R, where time increments and provider contact rules dictate absolutely everything. You have to clearly differentiate supervised modalities from constant attendance. Supervised modalities, like applying a hot or cold pack, do not require direct one-on-one patient contact. They're billed exactly once per session, regardless of the time spent. Constant attendance modalities, however, like therapeutic ultrasound, require the provider to be directly, continuously engaged one-on-one with that patient.
Because constant attendance and therapeutic procedures require that strict one-on-one time, they are billed in time increments, and the magic number you literally need to burn into your brain for the exam is 15.
When applying the CMS 8-minute rule for therapeutic procedures, like exercises under 97-110, neuromuscular re-education under 97-112, or manual therapy under 97-140, you calculate units based on 15-minute increments. First, verify direct one-on-one contact. Next, calculate total minutes. Then, convert to units. The standard goes like this. 8 to 22 minutes is 1 unit, and 23 to 37 minutes is 2 units. Note how 1 to 14 minutes is often simplified in study guides, but remember, the 8-minute threshold is absolutely key to making this work.
But beware of this massive trap. Never fall for double counting overlapping minutes across different time services. You absolutely cannot build 2 different constant attendance modalities for the exact same 15-minute window without clear documentation of separate, distinct, non-overlapping direct contact time.
Finally, Section 5, the CPC Fast Track Summary. Let's lock in everything we've learned today. Beware the pulmonary oximetry bundling trap. Always separate your allergy components, whether it's testing, administration, or prep. Memorize neurology's exact parameter and age rules. And for sure, never forget PM&R's supervised versus 15-minute one-on-one time rules. You won't want to miss our next explainer, Part 92. We are tackling high-yield medicine section case studies, complex hydration and infusion hierarchies, EKG component splitting, and really putting these PM&R time rules into practice. Think about it. If the exam threw a multi-layered hydration and therapy session at you right now, would your coding hold up? Keep studying, and I'll see you in the next explainer to find out.